Sticker shock at the pharmacy counter. Most of us have been there. One hepatitis C drug costs 93 times more here in the U.S. than it does in Egypt, for example. Members of the Senate Finance Committee are investigating why. A piece our next guest wrote about this was picked up by publications across the country. Dr. Steve Miller is the Chief Medical Officer for Express Scripts. Good morning.
Good morning.
So with so many medications on the market, I'm curious why you're focusing so much on Sovaldi.
Yeah, so Express Scripts' job is to keep drugs affordable for Americans. And this drug really is a challenge because it's truly priced at an extraordinary level. And so it's a new product that came out at the end of 2013, truly a breakthrough product. It works better than previous treatments, but it's just not affordable, and it's going to bust the budget of many states.
I mentioned 93 times more in the U.S. than Egypt. Would you break down the numbers for us? How much does the drug cost to make compared to what it costs here? All of that.
Yeah, so to make a complete regimen, which is 12 weeks of therapy, is less than $200. But in the United States, they're charging $1,000 per tablet, so it's $84,000 for a treatment course. If you go to Egypt, that same treatment course is only $900, which is less than one tablet here. But even in other wealthy countries like the United Kingdom, it's only $55,000. So Americans are paying a premium across any population in the world.
And I know in some cases, this ultimately comes down to taxpayers footing the bill. So a lot of our viewers are going to wonder, how does this happen?
Yeah, so it turns out that the biggest populations that have hepatitis C in the United States are the Medicaid population, so that falls to the states to pay for. The second biggest population are veterans, mostly of the Vietnam era, and the third biggest population are those who are incarcerated. If you think about those three big populations, what they have in common is their health care is funded by the taxpayer, and so we all are going to bear the burden of this.
So as we're talking about $84,000 for a course of treatment, how much of that would a state like Nebraska be expected to pay?
Yeah, so because Nebraska is a relatively relatively small state, it's about $200 million that Nebraska would be on the hook for to treat their incarcerated patients and their Medicaid population. But if you take this across the whole country, it's $55 billion that states are looking at as a potential bill for just the treatment of hepatitis C.
So you said before this works. I mean, this is an important medication. So do you think anything's going to change even as our senators are looking into it?
Well, what really is required in the marketplace, if we're going to have this type of marketplace, is we need competitive products to be out there. Because until we can get competitive products out there, there is no incentive for these companies to lower the cost. And so this has really become a huge issue because in the past, the model wasn't like this. It wasn't putting drugs out there at essentially what the market will bear. It used to have some semblance to what the costs were for production and discovery, and even for those losers that don't get to the marketplace. But this one's really put out there at whatever the market price will bear, and it's just not a sustainable model anymore.
Is there a website? I read your piece online and I sort of looked into this preparing for our conversation today and learned quite a bit more than what you and I have been able to cover this morning. Is there a site where you'd send our viewers to follow up?
Yeah, so we've created a site called lab.express-scripts.com, where we actually highlight not just the price of hepatitis C drugs, but many different drugs, and actually what the average consumer can do to hold down their pharmacy costs.
Dr. Miller, thanks for joining us today.
Thanks for your interest.
Thank you. Mike?